now. Feel your hair. It's soft and well groomed. I'm going to go ahead and feel your scalp for any abnormalities. Tell me if you feel any tenderness. Everything feel okay? Mm-hmm. All right, we're going to go ahead and feel your sinuses as well. Tell me if you feel any tenderness. How's that feel?
It's all good.
All right, good. I'm going to place my hands here. I want you to open and close your mouth for me. Any pain?
Mm-mm.
All right, no clicking, so no TMJ. That's what we're looking for. All right, so I'm going to test your nostrils, patency of your nares. Go ahead and breathe in for me. Very good. Excellent. In just a moment, I'm going to get your ears now. We're going to feel the outer auricle. No lesions or deformities. Any tenderness?
Nope.
Okay. Go ahead and look inside your ear. So your ear canal is clear. No impaction, erythema. Your tympanic membrane is pearly gray, which is normal. All landmarks visualized. I'm going to check the other side. Any pain or tenderness?
Mm-mm.
Excellent. All right, tympanic membrane is pearly gray on this side as well. All landmarks visualized. A small amount of brown cerumen in your ear canal, so you just got a bit of earwax. So we're going to look at your neck next. Okay. So I'm just going to look for obvious lesions, masses, abnormalities. Okay. I'm going to palpate your lymph nodes. So you've got your occipital, postauricular, preauricular, tonsillar, submandibular, submental, anterior cervical, and then both of your posterior cervical chains. And then I'm going to feel down on your collarbone. That is your supraclavicular nodes. And none of your... Tell me when you feel me touching your face. Feel it, feel it, feel it. Very good. And then clench your jaw for me. Relax. Clench again. Awesome. I'm going to test your sensation real quick. Tell me when you feel a soft touch on your face.
Feel it, feel it, feel it, feel it, feel it, feel it.
Very good. And tell me when you feel a pinprick.
Feel it, feel it, feel it, feel it, feel it, feel it.
Excellent. All right, now we're going to test cranial nerve like this. Push against me. And then hold. Very, very good. So strength is 5 out of 5 in both upper extremities. And then for your legs, I want you to go ahead and kick your knees out for me. Very good. Go ahead and press out against resistance. Pull in. Very good. And then with your feet, I want you to push up against my hands. Very good. And then push down like a car pedal. Excellent. Strength 5 out of 5 in your lower extremities as well. We're going to test your sensation. So tell me if you feel a light touch.
Mm-hmm. Yep. Yep.
Okay.
Mm-hmm. Mm-hmm. Mm-hmm.
Very good.
Mm-hmm. Mm-hmm.
Okay.
Mm-hmm. Mm-hmm.
Okay, we're going to do a pinprick.
Mm-hmm. 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 Okay. Mm-hmm. Mm-hmm. Mm-hmm.
Very good. Now we're going to test your vibration sense. So I'm going to...
Be quick and easy. Alrighty. I'm now going to place an object in your hand. Can you tell me what it is? Hold that up. Perfect. The point. Very good. I'm now going to trace a number in the palm of your hand. Tell me what number it is. 8. Good. So I'm just going to start up top and kind of work my way down. So I'm going to check your hair. Hair looks good. You're well groomed. It's all distributed evenly. Great. Okay, ready. So I just want you, I'm going to touch your joint right here. Can you open your mouth for me? Good, and close. Good, very good. So I'm just going to check your eyes, look at your lacrimal gland. No irritation or redness. Any pain at all? No. No. Cotton ball.
My forehead. My cheek.
Very good.
Again, I'm going to fill this area. Already checked those nodes, so we're good there. I do not feel any lumps, any bumps, any tenderness when I'm doing any of this.
No, ma'am.
Okay, and I'm going to percuss this area as well. Do that with the bell side of my stethoscope. And I'm going to come over here, and I'm at the second intercostal space as well. This time on the left sternal border, I'm going to be. And what I'm doing here, I'm just looking at your sclera. I'm looking for any discoloration. I'm looking at placement of your eyelashes, placement of your eyebrow with the eyes. Now I'm going to go to your ears, and I'm just going to feel your auricle. Any pain when I do this?
No.
Any pain on your tragus?
No.
Okay. Your ears are symmetric.
Hello, Mrs. Kucharian. My name is student Dr. Oganessian, and I will be doing your observation today, so history and physicals. So what brings you in today?
So I'm starting to get pain right here on the side of my toe, and it's been hurting.
Okay. Start with your vascular test. Okay, so I'll just be checking for your pulses. So this is your dorsalis pedis pulse right here. Okay. And that's good, I can feel that. And then this is your posterior tibial pulse, right behind here. Good, you have a very good pulse there. And this is called your popliteal pulses, okay. And those are great too. Okay, so pulses are all there. Now I'll test your skin turgor, which is great. The temperature feels normal and even. In both legs. And then I'll check your capillary refill. Okay, so I'm just squeezing on the toes here. Make sure the color returns, and it does, which is great. And then, yeah, and I'm assuming you shave your legs, but you have normal hair growth?
Yes.
On your feet, on your toes? Okay. Check your feet for any cuts, bruises, or abrasions. Your nails look fine, except of course for the little problem we have that one. Okay, and check the back of your foot here. Everything looks good. I'll be sure to be careful with this nail. Okay, looks good. Again, I don't see any cuts, bruises. I don't feel anything except for some. There's some redness and some swelling and tenderness, right? When I
yeah, right there.
Yeah, and then it feels a little warm.
Yes.
Okay. Okay, so that's good. Okay, great. So we're gonna check your knee reflexes. Okay. Great. And this one. Great. And then we'll check your ankle reflexes also. Okay. And this one. Okay, great. Those are great. Okay, now I'm gonna have you ask you to push against my hands. All right, push to the sides for me. Great. Push in for me. Good. Push down for me. Good. And then up for me. Great. Okay, those are great. If I could have you lay down again, please. All right. So this is called the Dubinsky test. I'm just going to run this against your foot and see the reaction. Okay, good. Good. Fulfillment or
Oh,
monofilament.
how scary. Okay.
No, this isn't scary at all. Give me your hand. It's just a little
Okay,
filament.
okay.
Just tell me when you feel it, okay?
Alright. Feel it. Yes. Feel it. 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 Yes. Yes.
Okay.
Yes. Feel it. Feel it. Feel it. Feel it. Yes. 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 Feel it.
Okay, great. So that's good. Reception. Okay, I'm going to touch your toe. Tell me which one I'm touching and if I'm moving it up or down, okay?
Down. Down.
Which toe is it?
It's the first one.
Okay, good. And then,
Third toe.
okay, and which way am I moving it?
Up.
Okay, good. And then, let's do this one. Which toe?
Last. Down.
Okay, great. Alright, now I'm gonna check the tightness in your calves, okay? So, slower sky test, okay, now bend your leg for me. Okay, looks good to me. And this one, put your foot in neutral position. And very good. Okay, if you could sit up for me.
Okay.
Next, we're going to do I'm going to palpate your trachea. Any tenderness? Can you swallow for me? Any difficulty swallowing? No difficulty swallowing. Next, I'm going to palpate the thyroid glands. Turn your head down and towards me. Swallow. Alright, do it the opposite way. Swallow. No tenderness noted, with just your eyes. Cranial nerve 3, 4, and 6, the oculomotor, trochlear, and abducens nerves are intact. Next,
Okay, so I'm going to start with your scalp. So have you just kind of look down. Thank you. We're going to look through your scalp. And Juliana did the right thing because she came in today without any makeup, any jewelry, any hair products, because that allows us to get a better, thorough exam. Good. I'm going to check behind your ears. Now, I have diagnosed skin cancer on pretty much every body part, including behind the ears, the fingernails, lips, genital skin. Close your eyes for me. And that's why we look everywhere. Turn your head this way. Turn your head this way. You can open up your eyes, open your mouth for me, and then close. Now, Juliana is wearing a bathing suit underneath this, just for purposes of the exam. But like I said, when you come in, we will see your hands like this. We're going to be examining your fingernails too. Like I said, I have diagnosed skin cancer of the fingernail. Flip for me this way. And Bob Marley died of a melanoma on his toe. So another reason why we check everywhere, because we see skin cancer on all ages, all skin types. Maybe lift up like that. Thank you. Good. Okay. Exam. It's a little light here. Okay, this doesn't hurt. You're just going to feel me kind of up close and personal. So everything looks great with this mole. It goes with the normal skin lines. Okay. Good. Look at the front.
Right. Your ears. Any tenderness?
Nope.
Okay, now I'm going to test your lymph nodes.
Okay.
Let me know if you feel any tenderness. Okay, your occipital, post-auricular, pre-auricular, parotid, tonsillar, submandibular, submental, post-cervical, interior cervical, and subclavicular. Anything?
Nope.
Feel your capillary
Mhm.
refill. Okay, it's about 1 second.
Okay.
Looks normal. Iliac. And femoral. I don't know if you feel any pain and palpation.
Nope.
No? Okay. Stand up for me.
Joint disorder. Instead of having our fingers dig into this very sensitive sore area, you can do what's called knuckle sweeps, especially if the piano fingers really aren't working for you. What you're going to do is use the flat parts of your knuckles and you're going to spin up, and you're just spinning up. So this is what it should look like. So you can see, and then again, if your client doesn't like a more active massage, just slow it down. What this is doing is just lifting and plumping the skin. Many people actually said it feels like there's a machine doing it instead. And this also helps to work in, and also remember when you're done, come around the nose, the mouth, and into the chest. Around the nose, the mouth, into the chest. And that's the, do they have heavy crow's feet, or even if they don't, just do a little bit of tension on the skin and work this all the way into the temple. Now remember that muscle goes all the way to here, so just make sure that you're not getting a lot of product in their hair, and they should be happy. Finish up with doing a little bit of upswing to get more of the masseters and the temporal joint, the temporomandibular joint muscles. Now this is the one that everybody likes to make harder than it is. What you're going to do is you're actually going to just balance your hand on her head, and this is only going to be using 2 fingers at a time. So from here, you're going to sweep out on that pointer finger. Lift up, sweep out. The reason why I have my hand here, it feels a lot more nurturing. And this way she knows I have control. With your other hand, you're actually going to cup it around underneath the chin. Now, if you have smaller hands, you may need to adjust your hands accordingly. With this one, you're going to come in, skin is on this side, where you can still see some congestion, where there's a little bit of congestion stuck around the mouth, and the eye is not high enough on this side. And even as young as she is, you're still going to see a significant difference with using these massage techniques. And there it is.
I'm going to look at your hair. It's well distributed throughout and very healthy. Perfect. So now what I'm going to do is I'm going to palpate your sinuses, okay? I'm going to palpate your frontal sinus. Any pain, tenderness?
No.
I'm going to palpate your maxillary sinus. Any pain, tenderness?
No.
Perfect. Now I'm going to palpate your temporal mandibular joint. So I want you to open up your jaw, close it. Now open it up and move it side to side. Perfect. Good job. I assessed that muscle right here for symmetry, swelling, and I didn't feel any. 2. Okay, now I'm going to look at your ears. Okay, so I'm going to palpate your auricles. They're symmetrical on both sides. I don't feel any nodules, no tenderness, no swelling. Are you having any hearing loss, any ringing in your ears?
Oh.
Awesome. Okay, I'm going to look in your ears. Palpate your occipital, your posterior auricle, or your anterior auricle, your parotid, your retropharyngeal, submandibular, your macular, your anterior cervical, posterior cervical, and your supraclavicular. Good job. All this, I don't feel any nodules. 2. Okay, now I'm going to look at your ears. Okay, so I'm going to palpate your auricles. They're symmetrical on both sides. I don't feel any nodules, no tenderness, no swelling. Are you having any hearing loss, any ringing in your ears? Awesome. Okay, I'm going to look in your ears. Masseter muscle. They feel symmetrical on both sides. Once again, no swelling. Any tenderness or pain?
No.
Perfect. Okay. I don't see any nodules, no swelling. Any tenderness?
No.
Perfect. Okay. I'm going to feel for her trachea. Her trachea is midline. Okay. I'm going to feel for your thyroid. Okay, so I'm going to have you swallow a few times. Okay, so I want you to swallow. Good job. I want you to turn your head to the left and swallow. Perfect. Now turn your head to the right and swallow. I know it's hard to swallow on command. Good job. That was perfect. Okay. Can't talk today. Okay, so now what I'm going to do is I'm going to check your lymph nodes. Okay, you have a bunch on your neck and your head. Okay.
Okay.
So I'm going to start from the back. I'm going to palpate your occipital, your posterior auricle, or your anterior auricle, your parotid, your retropharyngeal, submandibular, your macular, your anterior cervical, posterior cervical, and your supraclavicular. Good job. All this, I don't feel any nodules most of the time. And then you're going to feel for your kidneys, which most of the time you can't feel them either. Okay, good job. Now the last thing I'm going to do is test your abdominal reflex.
I notice that her hair is evenly distributed, and as I'm palpating, I don't notice any abnormalities like lumps or bumps, no lesions or anything like that. While I'm here, I'm just noticing, inspecting the head. I'm just going to check your frontal and maxillary sinuses. So if I could palpate and you tell me if you have any pain. Here.
No.
Here.
No.
Here.
No.
Here.
No.
Okay. And we're just going to, I'm going to pull down your lower lids just a little bit, check your conjunctiva. They appear pink and moist, no cobblestoning. We have excessive piercing. The skin is intact. Next, we're going to palpate for any pain in the auricle and tragus. If you could tell me if this gives you any pain.
No.
Tenderness here.
No.
No. Your lymph nodes. So we're going to start with the pre-auricle, the post-auricle, occipital, the post-cervical chain, and back up, the pre-cervical chain, anterior cervical chain, and back up, the tonsillar, mandibular, and submantle, and the supraclavicular. All right. Check the arms, elbows, the hands. No obvious deformity here. We're just going to check for capillary refill in each fingertip. They're equal, bilateral, and less than 3 seconds in each fingertip. If I could have you...
Aspiration's 18, O2 saturation 99%. No temperature, normal temperature. Assessing the skin, patient's uvula, the mouth, tongue, side to side, up and down. Assess the scalp for any skin, any remarkable items. Normal, healthy skin and hair. Continue with cranial nerves, checking the eyes, range of motion. Checking peripheral vision. Temperature check with the back sides of hands. Also, while looking at the skin, any marks or lesions. Patient has normal skin and color for ethnicity. Cap refills are less than 3. Once again, strength exercises of shoulders and arms. Patient has normal range of motion and strength. Bilateral pulses are equal.
Color is good for ethnicity. So I'm just looking for any masses, bumps, lesions. Have you had any painful areas on your scalp? Okay, I don't see any parasites or anything. Hair is distributed evenly. Colic. Now I'm just going to palpate your sinuses. Tell me if there's anywhere painful. Okay, I'm checking your temporal pulse on both sides. And it is palpable. I'm gonna have you squint your eyes and then puff your cheeks. Cranial nerve 7 is intact. Can you move your jaw? That's cranial nerve 5 intact. Have you had any painful areas on your ears? Okay, so no masses or lesions are noted. Alright, I'm going to pull up and back and look. Tympanic membrane is pearly gray, and now I'm going to do your lymph nodes. So we have the pre-auricular, post-auricular, the occipital, and then the tonsillar, submental, submandibular, superficial cervical chain, deep cervical chain, posterior cervical chain, and supraclavicular. Do you have any abnormalities that you've noticed? Any pain in the joints? Okay, I'm checking the epitrochlear nodes. None of those are palpable. Your skin is normal to ethnicity, is dry, intact, no lesions noted on the arm or anything. I'm going to check your brachial pulse. That's a grade 2. We checked the radial, it's a grade 2 also. Okay, now I'm going to push against me and pull. Okay, muscle strength is a grade 5 in the legs. Can you push up and push down? Muscle strength in the feet is a grade 5 also. I'm going to check your legs. There's no edema noted. The hair is distributed evenly. I'm going to check the popliteal pulse. That one's not palpable.
I'm going to check your posterior tibial. That is a 2+. And the dorsalis pedis. That is a 2+ also. Your legs are symmetrical. Your feet don't have any messes or lesions. I would check cap refill if you didn't have on toenail polish. There's nothing on the bottom of your feet. And now I'm going to check your quadriceps reflex also.
I don't see anything. Your hair distribution is even. Any pain or tenderness led to that?
No.
Okay, I'm going to check your ears. Any pain or tenderness here?
No.
Awesome. Then I'm just going to check your lymph nodes. Start with your occipital, post-auricular, pre-auricular, parotid, tonsillar, submandibular, submental, anterior cervical, posterior. And then skin is intact, coloring is good. I don't see any bruises or lesions. Any concerns about your skin?
No.
Okay. Just going to take a feel bilaterally of your radial pulses to make sure they are equal. Equal rate and rhythm. They feel strong. Very good. Capillary refill is less than 2. Everything looks good there. So now I'm just going to take a listen to your heart.
Please let me know if there's any tenderness, okay?
All right.
So the maxillary sinuses,
No, good.
the rhythmoid sinuses, and the frontal sinuses.
All good.
Okay, great.
Yeah.
Cool. Okay, so your trachea looks midline, no deviation.
Okay.
That's great. And I'm going to palpate the thyroid. And could I have you swallow, please? That feels healthy.
Okay.
Sometimes we get some nodules on our thyroid, which can be common and usually benign, but something to keep an eye on.
Okay.
Your submental, your submandibular, your anterior something, your posterior something, and your supraclavicular lymph nodes. Okay,
Massage.
great. And I'm noticing no edema. Your skin is pink, warm, and dry to touch. Capillary refill looks regular. Sorry, less than 3 seconds. What happened to these toenails?
Yeah, they're pretty rough shape.
Yeah, this one looks a little painful.
Just a little.
Yeah. Okay, any pain or tenderness here?
Right foot, ankle-ish. Left calf. Right hand. Left shoulder. My nose. Right shoulder. My stomach, I think. Left knee.
Okay, great.
Thinking may be wrong might occur in your head as well. So I'm just going to look. I see that her skin is pink and intact. She doesn't have any lesions. There's no dryness noted. Her hair is evenly distributed, so I don't see any issues there. On her face is symmetrical. I don't see any obvious lesions. Her skin is pink and intact. Nares appear pink and intact. The skin is fine and moist.
Open lesions, anything like that.
Okay.
I'm going to feel your scalp here. I'm just palpating for any abnormal bumps, deformities, things like that. No tenderness?
No.
Okay. I'm going to have you clench your teeth for me. Very good. And then stick out your tongue. Perfect. Just feeling your sinuses. Does any point feel tender right now?
No.
Okay. Very good. Taking a look over your neck, I'm just going to palpate your sinuses and lymph nodes. Very good. Okay, I'm just checking your trachea. It's midline. Can you swallow for me? Excellent. Can I now?
Okay.
I'm looking it over for any deformities. Skin looks good.
I'm going to have you take a deep breath. Okay, very good. You're going to feel my hands move along your back each time I tell you to. I want you to say 99 for me. Okay?
Okay.
Okay?
99.
Okay?
99.
Okay?
99.
Okay?
99.
All right. All right. I'm looking over your cap refill. Good on that side. All right. Next, I'm going to feel your radial pulse.
Okay.
All right. This side, please. Okay. Now I'm going to palpate. Same thing. If anything hurts, just let me know. I'm going to move on to your legs now, just looking them over, same as the arms, looking for any birthmarks, bruising. Okay, I'm going to have you raise your foot for me. I'm just feeling your posterior tibialis pulse.
Okay.
And now your dorsalis pedis pulse. Leg, you feel me tap? Good. Last one is the Achilles.
Okay.
You're going to feel me tap kind of below your ankle bone here. All right. Now the last thing I'm going to check is your plantar reflex. So I'm just going to stroke your heel. Okay, good. There's no movement.
So go ahead and stick out your tongue for me. All right, good job. Definitely intact. All right, we're going to
Distribution's appropriate. No edema on your feet. Collar feels cool to the touch. Can you wiggle your toes for me? Can you feel it when I touch the ball? Okay, capillary refill. It's less than a second. Gonna feel your pulses. Posterior tibialis. Can you
push down
for me? Okay, good. And do you have any problems with walking?
Nope.
Hi, I'm Adriana, and you are? Well, I'm going to be doing a head disc assessment with you today. First, I'm going to have you stand up and stand with your feet close together, and then go ahead and close your eyes. Okay, good. Now you can go ahead and open them. I want you to take a few normal steps that way. Okay, and then turn and come back on your heels. Good, and then turn one more time and walk that way on your toes. Nose, toes, all same. Whoop, stay down there. Oh, stay down? Okay. Okay, I'm going to check for scoliosis. Perfect, you can stand back up. I don't see any scoliosis, any lordosis, any kyphosis, none of that. Okay, so now what I'm going to have you do is lean back towards me. Perfect, that's extension. Then I want you to stand back up. Your arms, your shoulders, all that looks good. Okay, I'm going to feel for any swelling, any unevenness. Any pain, tenderness? Go all the way down your arm. Your muscle mass is equal on both sides. I don't feel any epitrochial nodes on your elbows. I'm going to look at your wrists and your hands. All of those are normal. Your fingernails are intact. I don't notice any clubbing. Cap refill is definitely a 2. Looks great there.